Carpal tunnel is basically exactly what it sounds like. So carpal bones are here. Tunnel is basically the gap between the two inside here. So there's a tunnel in here, and carpal is basically the bone. So in here in this segment area, there is a compression inside, whereas the nerve is being squeezed or, in a sense, impinged. So when that happens, you get numbness, you get tingling sensation, or kind of like a prickling feeling there. And of course, pain can be in this whole area in the palm. It could be in the wrist joint on the top or on the bottom, the surrounding area. And sometimes when you try to move your wrist joint up or down, then it gets pain all the way up or refers up. So it depends on the situation of the type of the impingement. So sometimes you'll have none of the symptoms, except like you won't have numbness, but you may have a lot of pain in the area. So you won't be able to move your wrist joint completely because the pain is so bad. But that could be a mixture of the condition, not just because of carpal tunnel. So it usually affects more women than men, but on an average scale, more women than men gets affected for the carpal tunnel problem. But it does not limit to only females, because men do end up having them as well. Age group wise, it doesn't really factor in as much. Average is starting from 40, but you could be as early as 30, 35. There are kids that have carpal tunnel, but those are more rare cases than anything else. Those are an actual problem inside causing that. After COVID, there's been a lot more cases where people have been complaining about that. But prior to COVID, we also have a lot of those cases regardless, like people coming in because of nerve impingements, similar to it. They don't want to do surgery for it because they want to avoid surgical procedure as much as possible. So they come in to get therapy done instead of doing surgery. So a lot of times we find you actually don't need to do surgery unless it's an impingement specifically inside the nerve root somewhere in your neck, whereas surgical might be a better intervention. But again, that's a mixture of that topic there, because it depends on the severity. So even if it's inside here, you may not need surgical intervention. So it depends on what's going on. So you need proper assessment from someone to figure out like where that impingement is coming from. That's first thing. Secondary thing is to look at, is there other causes that might be affecting the nerve impingement from here? So it could be anywhere from, it could be the tunnels from here, it could be from the forearm from here, it could be from the tendons from here. For all we know, it could be the muscles on the top, underneath there, but it could also come from the underarm on the back of the shoulder blade muscle. So all those, because nerve travels towards that way. But majority, the nerve supposed to be compressed is only on your thumb and your index finger. But majority of the people that come in is not just these two, because they're also having on the palm of the hand and also the third finger, fourth, and the fifth as well. But there's no like 100% just because you have a carpal tunnel, you can only have it in these two, because there's two nerve that runs down that also affects both. There are ways that you can strengthen the muscles on your shoulder blades to help that, so then your shoulder doesn't get rounded forward and the nerve doesn't get compressed, specifically in the nerve root on the top and also underneath from there. There's another condition that's very similar. It's called thoracic outlet syndrome, which is the thoracic the bypass between the nerve inside there is also gets compressed, and then that will shoot the compression down to your hand, making that look like carpal tunnel. So that's a similar condition that can also mimic that kind of a nerve pain specifically. But again, it depends on the situation as well. A lot of times surgical intervention isn't necessary, But if they want to speak to their family doctors about it, and then what the family doctors can do, two things. One is an x-ray. So x-ray can go into the neck, take a look at to see if there's an impingement on the neck spine. So whether you come for therapy, we also suggest that as well, just to see or to rule out if there's other conditions involved with it. So x-ray will be one. Secondary is the neurologist. So a neurologist can do something called a nerve conduction test to look at, is there an impingement of the nerve from here or impingement of the nerve from there, or whichever the case may be. However, once they find out there is an impingement, the next recommendation from the neurologist, usually it's because depending on your pain level. So if your pain is severe and then your numbness is still severe, then they'll do a nerve block, which decreases the pain for you and numbs the nerve. Or secondary, what they'll do is surgical. So they'll go open and make an incision from here and then find some way to cut certain pieces in order for the compression not happen. So that's another way the surgeon will do. But a lot of people opt out from doing these because you will have scarring. That does happen. And sometimes that surgery doesn't work well, and then you'll still continue having that problem. And that's usually when people come in to see us, because after surgery, they still come back and still having the same problem. Then we work on other areas that's actually associated with this, and the pain is gone. So technically, they didn't even need to have surgery in the first place. So assessment is the key. So if they're just looking for nerve conduction, then for sure there's going to be impingement, and for sure it's going to test positive because there's an impingement of the nerve. But just because you have the impingement of the nerve doesn't mean that that's the cause of that problem. There is something causing the impingement of the nerve, and you have to work on that before you address the nerve. So if you fix the cause of the impingement, you ruled it out, that is fixed 100%. The nerve is not being compressed in any shape, form, or matter, but you're still getting that numbness and tingling. That's when you can think about surgical. So there's a lot more room to proceed with the therapy before you can actually do a surgery. Like there's a lot of room to give on that.